Hi, my name is Dustin. I'll be your nurse practitioner today. Can I have your name and date of birth?
Rachel Martzoff, 9/29/97.
Alright, today we're going to examine your head, your eyes, your ears, your nose, your throat, and also your skin and nails. Do you have any questions before we begin?
No.
Alright, so I'm just going to inspect your head. Everything all looks symmetrical, normal cephalic. I don't see any redness, dryness, any abrasions, lesions, any tics or involuntary movements. Do you deal with any dryness or anything?
No.
Okay. So we're going to go ahead and do some head movements. I'm going to have you look up. I'm going to have you look down. I'm going to have you look to the right, to the left. And I'm going to have you look at me. I'm going to have you tilt your head. And then go ahead to the other side. And then I'm just going to have you go all the way around. Any pain, discomfort with that?
No.
Okay. And again, I didn't see any rashes, any macules, papules, or anything like that as well. Hair distribution looks normal as well. We're gonna go ahead and move on to the nails. I'm just gonna go ahead and inspect them. So I don't see any broken nails or anything. Cuticles are intact. Don't see any hangnails. It's hard to inspect the capillary refills due to the painted nails. I don't see any sores or anything like that. Next, we're gonna check for clubbing. So I'm gonna have you put your nails together like this. Next nail, next, and the thumbs. Perfect. No clubbing noted. Nails are all even in texture as well as the thickness. Okay, so I'm gonna go ahead and inspect your skull and palpate. Let me know if you have any pain or tenderness with this as well. We're also gonna be looking for any bumps, lumps, or indentations. So your occipital, just all the way around. You have any pain with this?
No.
Sorry. Alright, so it's all even in texture. Hair distribution is even as well. Again, no dryness, anything like that. Hair isn't brittle. Okay. Alright, next I'm going to palpate your frontal and maxillary sinuses. Let me know if you have any pressure with this as well. Okay. Any pressure there?
Mm-mm.
Any pressure there?
No.
Good. Alright, next we're going to look at your temporal mandibular joint. Okay. So I'm going to have you open up, close, open, close. Alright, any pain or tenderness with that? Okay, I didn't feel any popping or anything like that, anything unusual there. And then next I'm just going to feel your temporal arteries. Sorry. Alright, they're even on both sides, +3. Next, I'm just going to inspect your eyes. Okay, eyebrows, eyelashes look even. Normal hair distribution. Everything looks intact there. Your sclera is white. I don't notice any like yellowness or jaundice. And just from looking, I don't see any broken blood vessels as well. I'm just going to look at your conjunctiva. Good. Looks pink. Doesn't look any paleness or anything like that. Your lacrimal ducts look intact as well. Do you have any eye problems?
Just wear contacts.
Contacts? Okay. And you have them in today?
Yes.
Okay. So we're gonna go move on to the Snellen chart. Okay. So I'm gonna stand a couple inches away here, and then I just want you to read the lowest line.
4, 2, 6, 7, 3, 9.
Okay. I'm gonna have you close one eye.
4, 2, 6, 7, 3, 9.
Okay. And the other eye.
4, 2, 6, 7, 3, 9.
All right. And it looks like we were 20/20 in all eyes there. Then next we're gonna test your peripheral vision. Okay. So I'm gonna put my fingers around you. Okay. Just let me know whenever you see them. Okay.
No.
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 Okay. Then this way.
No.
Okay, good, good. That's all intact there. Next we're gonna do the 6 cardinal fields of gaze. I'm just gonna have you follow my finger, okay? Start midline, so up, down, midline, back to middle, up, down, midline, back to normal. Alright, and that was all good there too. No nystagmus or anything. Cranial nerves are intact in there as well. Next we're gonna so I'm just going to take a better look into the eyes here, okay? So I'm going to have you look at an object behind me, okay? okay? And then I'm just gonna look for any like broken blood vessels, look at the red reflex, optic nerve, all that as well, okay? Alright, so go ahead and look at an object behind me. So your red reflex is intact, optic nerve is intact as well. Red reflex is positive. Okay, I'm just going to move on to the other eye. Have you looked at an object behind me? So again, red reflex is intact. Optic nerve seeing good. Again, sclera is white. I don't see any broken blood vessels in each eye. We're gonna go ahead and move on to this. So I'm gonna have you again look at an object behind me, and I'm just gonna test for your pupil constrictiveness. Okay. Good. Okay. Pupils are equal and reactive bilaterally, from like 2 to 3 millimeters. Okay. Next we're going to do the accommodation test. Okay, so I'm going to have you stare at the tip of this pen light. Good. One more time here. Good. Okay. And that is good as well. Okay. Now I'm going to have you again look at this, okay, and then I'm going to have you look at an object behind, and then back to the pen light, okay? Okay. Object behind me. Good. And then again. Good. Okay, pupils constrict, dilate there as well. No issues there. So we're gonna go ahead and move onto the ears. I'm gonna have you just pull your hair behind the ears here. So they look symmetrical on each side. Just from looking, I don't see any drainage, any sores, redness, or anything like that. I'm just gonna go ahead and palpate. That temperature's even, normal on each side there. Let's see. No erythema or drainage, as I said. So we're gonna go ahead and do the whisper test, okay? So I'm gonna have you plug one ear, I'm gonna whisper a word, I just want you to repeat it, okay?
Football.
Good. Other ear?
Baseball.
Good, good, good. That is good as well. So next we're gonna do the tuning fork, okay? So I'm gonna hit this, I'm gonna place it on your forehead, and just let me know which ear you hear then, okay? Which ear? Good. All right. Next, we're gonna. I'm gonna place it now behind your ear. You're gonna hear the noise, and let me know whenever you don't hear it anymore. Then we'll place it in front of your ear. Okay. Right.
No.
So.
No.
Good. All right. So air conduction is greater than bone conduction. There. We're just gonna test the other ear, and that is good.
No. No.
Good. Good. Same thing there. Air conduction is greater than the bone conduction there as well. So that is good. Next, we're gonna go ahead and look in your ear. Okay. All right. I'm just gonna pull your pen up and back here. Is there any pain with that as well?
No.
So looking in the ear, tympanic membrane is pearly white. I don't see any bulging, nothing, no drainage in the ear canal as well. Okay. Any issues with the ears at all? Okay, we're just gonna go up and back again. Same thing over here, tympanic membrane, pearly white, no bulging, no drainage in this ear canal as well. I don't see any sores or anything like that as well. Alright. And you said there was no pain with pulling on that ear as well. Okay, good. Alright, now we're going to go ahead and move on to the nose. Okay, just looking at it, everything looks symmetrical. Septum looks midline as well. I don't see any drainage, redness, anything like that. We're actually going to look into the nose as well here. Okay. So I'm going to have you lift up your head. So just looking here, no drainage, sores, redness, or anything like that nose. Septum is midline. The canals, everything. No redness, like I said, drainage, no polyps, no deviation on the septum as well. Okay. Any issues with your nose, any like recent drainage or anything like that? Good. So looking at your mouth, pink, your lips are nice and pink, moist, no cracks, bleeding or anything like that. Just look in there. We're gonna go ahead, actually go put this back on here. I'm gonna have you open up here. Okay, I'm gonna have you say, I'm just gonna take a look at your uvula, tonsils, and all of that there. Okay, ready? Let's say, Good. Okay, uvula's midline, it went up. Tonsils, no swelling, redness, anything like that. I'm gonna have you lift up your tongue here. Okay, good. That's all intact there. Everything's moist, soft, and all the palates look good there. The sublingual ducts, as I said, it's intact, no lesions, polyps, sores, pink and moist. Any issues with your tonsils, any problems like swelling or anything like that?
No.
Okay. It all looks good there. Indentation wasn't intact too. I don't see any broken teeth, missing teeth or anything like that as well. Okay. So we're gonna go ahead and move on to the lymph nodes. Okay. So with this, we want it less than a pea size, no tenderness, no swelling or anything with that too, okay? Let me know if you do experience any tenderness, okay? So we're gonna look at the preauricular, postauricular. We're gonna go to the occipital. We're gonna go, to the tonsillar. Submandibular, submental, anterior cervical, posterior cervical. Good. And then we are going to go to the supraclavicular and infraclavicular. Okay. And just with palpation, I didn't notice any swelling. No tenderness with that?
No.
Good. That I'm going to inspect your trachea here. Okay, just by looking at it, I don't notice any like goiter, swelling. Everything looks midline there as well. No deviation. I'm gonna go ahead and move it side to side. Let me know if there is any pain with this, okay? It moves side to side easily. No pain with that? Okay. No torticollis with that as well. Next I'm gonna stand behind you. We're gonna look at your thyroid, okay? I'm gonna have you swallow and just feel it moving up and down, okay? Alright. So feeling the thyroid, go ahead and swallow. Good. Alright, that looked good as well. And then next, no border as I said. And then now I'm gonna go ahead and listen to your thyroid for any bruise. Okay. With the bell part. I'm gonna have you hold your breath. Good. No breweries noted there, and one more time. Okay, good. And again, no breweries there. Okay. So I didn't feel like any lumps with the inspection, palpation, or anything like that as well. Do you have any questions for the day?
No.
Okay. Well, thank you.
You're welcome.